Hi everyone, my name is Elizabeth Klesner, and this fall I had the incredible opportunity to work as a contact tracer for the current COVID-19 pandemic going on for the Johnson County Public Health Department here in Iowa City. And as a contact tracer, it was my job to inform the public of Johnson County who were exposed to COVID about their exposure, when that was, and the next steps to take based on that exposure. And the goal of this project ultimately was just to contain the spread of COVID-19 in the community by informing individuals of the importance to quarantine when necessary and what exactly that means for them. So pandemics can be a huge public health threat to our community because they can disrupt the way we live as well as the well-being and health of our communities. And they can be also very difficult to overcome because a lot of people are not always willing to cooperate with the health recommendations, even though they're not easy to follow most of the time. But the role of Johnson County and the Public Health Department is to provide public health guidelines to the people who test positive for COVID, as well as people who are exposed to COVID in order to prevent this virus from spreading any further, to keep everyone in our community ultimately safe, and to keep people who have underlying health conditions especially safe as well. And another function for the Johnson County Public Health Department is to educate the community about what it means to quarantine and what it means to isolate, and just the importance of being safe at a time like this during a global pandemic. Okay, so moving on to my project description. So my two primary roles for this project included conducting disease investigations for people who tested positive for COVID, and also doing contact tracing for people who have been exposed to COVID-19. So I was usually assigned to place phone calls to people who test positive for COVID, and I would ask them to fill out a quick questionnaire just regarding the symptoms they've had and maybe where they work, who they've been exposed to both in their home and outside of their home, just to collect information about themselves and to get an idea of who they've been around. And once they've completed this questionnaire, I would gather more information with them. So I would give them a call back and I would obtain more information about the contact information of the people they've been around within 2 days before their symptoms started, or 2 days before their positive test if they were an asymptomatic case. And from there, ultimately, I would call these people who have been exposed, and I would notify them of their exposure and provide them with the proper public health guidelines and to make sure that they are willing and able to quarantine. And some other examples of my work that I usually do from day to day include providing work release letters to people who need to quarantine so that they're able to give these letters to their boss to make sure that they really do need to quarantine, and this is an important matter. I also input data of people who have tested positive into this system called IDES, or the Institute for Data, Systems, and Society. I also wrote very detailed notes about a positive COVID cases information just regarding the symptoms they've had, people they've been around, both in the home and not, and their job, when their last day of work was, and maybe if they've traveled or not. And finally, I would often send letters to people who we were unable to contact regarding getting their information. And we would just send them a letter giving them public health guidelines summed up in a short letter about whether they need to quarantine or isolate based on their exposure dates. And moving on to my personal assessment. So prior to starting this internship, my bosses had me, as well as my fellow contact tracers, watch many training videos, which ranged from being certified in HIPAA to learning about what contact tracing is, how the process is completed, and important questions to ask, as well as learning about inputting data and just becoming more familiar with the rules and regulations by the Iowa Department of Public Health for their COVID guidelines. And I believe that from this experience over the last few months, I've really been able to refine my ability my abilities to communicate well with others, both people I work with and people I call every day over the phone, because I speak with a diverse group of people every day, as well as being able to work well in a team, because we often come across very new or unusual situations where we really need to think about what we're doing and make sure that we're making the right call about everything. But I believe my most significant accomplishment I had was being able to adapt to the increased workload that we had both at the beginning of this school semester, so at the end of August, and then a few weeks ago in the beginning of November, because that's not always easy to deal with, and it requires having to just really work a lot harder and know what to prioritize at the moment. But many people in the Johnson County community, unfortunately, are not always aware of what public health guidelines are for COVID-19. So that has been a challenge, because people might hear the wrong guidelines, or I have to spend extra time over the phone just talking to them, just talking everything out and making sure that they really do understand what steps they need to be taking, so we can further slow the spread of COVID-19 going around. And finally, for my conclusion, I think this experience has really helped me out a lot for just regarding my future plans and my goals. I've realized that public health is definitely not an easy field to be in, but it has also been very rewarding. And I look forward to seeking new opportunities in this field, and I can see myself working at a public health department, kind of similar to this one, at a community-based level as well. But I think my goal as of now is just to seek more relative experience in this field of public health, just at a community-based level, gain more knowledge and work with new and more people, and continue to learn every day, because that's really what I've been doing for the past few months. But I also finally wanted to give a big thank you to my bosses, who are disease prevention specialists, and those are Amelia, Jacob, and Jennifer. They have provided me with so much knowledge over just the past few months about learning about contact tracing and just making good judgment calls. So thank you.